All right, good afternoon and welcome to today's session. We will be using the Q&A and chat box functions found at the bottom of your screen during this session. If you experience any technical difficulties, you can use the chat box to connect with college staff and we will attempt to assist you. To ask questions during the presentation, please use the Q&A function. All questions are visible to all attendees, and you have been given the option of upvoting questions by clicking on the thumbs up icon found below each question, and they will be answered at the end of the presentation. We are now broadcasting live and recording, and you are ready to start.
Well, good morning and good afternoon, everyone. Thank you so much for being with us today. My name is Kathy McNeil. I'm the president and CEO of Island Health on the beautiful island, Vancouver Island in British Columbia. And so glad that you're able to join us for this webinar on green healthcare. I'd like to start today by acknowledging with respect that we're hosting today from the traditional territories and ancestral lands of the Indigenous, Métis, and Inuit peoples across this country. We invite you to take a moment to reflect on the cultural importance of these lands as we honor those who walked before us, along with those still to come, and to reaffirm our commitment to forging culturally safe relationships on our pathway towards reconciliation. Please join me in also acknowledging the Indigenous culture of knowledge sharing that leverages collective experiences and allows people to learn from one another. It's in that spirit of mutual respect and collaboration that we come together today and learn from each other. Before we begin, I'd also like to acknowledge and thank the dedicated college members, healthcare workers, industry partners, and leaders who are actively working diligently to manage the COVID-19 pandemic across this country and across this globe. And I want to particularly acknowledge, I know, the pressures that our colleagues in Ontario, Quebec, Alberta, British Columbia, Manitoba, Saskatchewan are particularly feeling at this time. And please take care of yourselves so that you can take care of others. So we're joined today by three leaders in this field of green healthcare who are going to speak to us about their learning, their experience, and their call to action to the rest of us who lead in this health system in our own spaces and places across the country. I'd like to introduce them to you, and they'll take turns presenting their material, and this truly is a global presentation today. We'll start with Daryl Quantz. Daryl is registered as a UK consultant in public health and has 20 years of experience delivering population health programs and services. He recently finished working across Public Health England and the Greater Manchester Health and Social Care Partnership, where he led the public health response to the climate ecological crisis and air quality. Daryl is passionate about addressing the wider determinants of health and is dedicated to contributing to the transition to a high well-being, equitable, and environmentally sustainable economy. Welcome and thanks for joining us today, Daryl. I'd also like to introduce you to Dr. Jeff Thompson. Jeff is the former CEO of Gundersen Health System, pediatrician, and author of Lead True, Live Your Values, Build Your People, Inspire Your Community. Jeff was CEO of Gundersen Health System for 14 years, responsible for improving quality, lowering cost, and advancing care into the community. He served a staff of 7,000, hundreds of thousands of patients, and yearly spent $1 billion of the community's money. His long experience as an intensive care pediatrician and senior executive have shown him how leading from one's values can affect tremendous lasting change. During Dr. Thompson's tenure, Gundersen Health System developed an energy program that decreased greenhouse gases by 95%, decreased hazardous pharmaceutical waste by 98%, and did those in a fashion that decreased the cost of care and improved the local economy. Gundersen was repeatedly recognized nationally for excellence in quality and cost effectiveness. It has earned HealthGrade's highest honors, America's 50 Best Award for 2012 through 2016. In 2015, he received the Practice Green Health Visionary Leader Award and was the only US provider to speak in the Blue Zone at the Paris Climate Talks. Dr. Thompson received the White House Champions of Change Award in 2013. Welcome, Jeff. We're glad to have you with us. And I'd like to introduce you to my friend, Neil Ritchie. Neil is the Executive Director of the Canadian Coalition for Green Healthcare, a national non-for-profit network of healthcare organizations here in Canada, focused on building capacity and enabling tools for environmental sustainability in our healthcare system. Neil is an experienced healthcare executive who has worked as a hospital CEO, Chief Operating Officer and Vice President of large multi-site academic teaching centers, regional health authorities, and community hospitals in Canada. He was also founder of the Business Development Office at Dalhousie University's Faculty of Medicine, led several health technology startup companies, and completed many consulting projects. Neil holds a Bachelor of Science degree from Dalhousie University and a Master's of Health Service Administration from the University of Alberta. I've had the privilege to work directly with Neil, and I think we're in for a great session today from all three of our panelists. So with that, I'm going to hand over to Daryl, who will speak to us about his experience in the UK.
Thanks, everyone. Just start my slideshow here. So good morning or afternoon, everyone, depending on where you are. I just want to start by acknowledging that I'm speaking today from the unceded territories of the Suk First Nations on Vancouver Island. Thank you to everyone for this opportunity to share my, as Kathy mentioned, my public health experience working in the NHS for the last 2.5 years before I recently repatriated to Canada. Just to set some context for you, Greater Manchester is a city region of about 2.8 million people. 10 local governments, kind of the center of power in the north of England, multiple hospital and community mental health trusts, and significant public health challenges driven by social, environmental, and economic conditions, which are reflected in differences in healthy life expectancy by up to 18 years between different areas. So to share with you my experiences, I think it's just easiest to break it down into 4 different objectives that we had for the health and care system around the environmental agenda. And the first objective was to communicate the impacts on public health from climate and ecological crisis. And a key reference point for us was the ongoing work of the Lancet Commission on Climate Change, which over a decade ago declared that climate change is the greatest threat to our health and well-being. It threatens to undermine all of the public health gains that we've made over the last century, and it will exacerbate already difficult health inequalities, and particularly so for the next generation. Although 2020 will be remembered for the pandemic, of course, global warming continued to impact the planet with record temperatures in the Arctic hitting 38 degrees, massive fires in the US that created terrible air quality conditions across Western Canada, and of course, continual flooding, particularly in the UK, where it's just been on continual issues of that. It's also important to recognize that it's not just global warming, this is an ecological crisis. And I can't go into this in depth, but the Dasgupta review that came out last year on the economics and biodiversity is a fantastic resource on the connection between our well-being and nature, and that current activity is threatening both our health and the health of future generations. And a lot of that was reflected in particularly the early narrative of the pandemic from environmental scientists and others, the UN Chief Environment Officer, that the pandemic is just one symptom of the negative impacts that human activity is having on biodiversity. Current extinction rates are around 100 to 1,000 times higher than average over the past several years. And the patterns of extinction combined with climate change make pandemics and infectious diseases an ever increasing threat. So as a health system, we did a lot of work to communicate all of this vast amount of information on these impacts. We worked to secure agreement on becoming the first integrated care system in the country to declare a climate emergency. And that was important for us because we're reframing the environmental issue as a health issue, but it also helped us to mobilize leaders and staff in the health system. I'm just going to highlight one other impact that's very close to my heart, and that should concern all of us greatly, and that is the mental health impacts of climate anxiety. Of course, this can affect everyone, but it's a particularly concern for young people. In the UK, a recent survey found that 1 in 5 children between 8 and 16 reported sleep disruption because of climate worries. We know that healthy child development is arguably the most important determinant of lifelong health and well-being. So we need to be aware of this additional impact that we're putting on a generation that is already struggling. The second objective of the work of our health system is actually an incredibly powerful and positive message, and that is to ensure that we highlight and work to achieve the population health gains that are possible from the right environmental actions, including reduced demands on the health and social care system. And there are so many benefits to population health that can be achieved through careful environmental action. Cleaner air and more physically active populations is an obvious example of what can be achieved from policies that prioritize active travel. Healthier eating, of course, be a result of a more sustainable diet. But I think really the greatest opportunity that can come from this is rethinking our economy and how we can ensure it is environmentally sustainable and is able to reduce income and health inequalities. So in Greater Manchester, we embrace the concept of the health system being an anchor institution to achieve population health gains and help meet environmental goals. There's a lot in this slide, you'll have them so you can review this, but basically it's a summary of this work and how we connected it to the emerging net zero greener NHS plans. And these are things such as a living wage for staff and contracted staff, sustainable procurement policies that support local economies, and using our estates as green spaces for the community as just some examples. Our third area of action was around collaboration and partnership and advocacy, and that was such a critical piece for us as well. And during the time that I was there, a key activity was working closely in the development and delivery of the city region environment plan. There was significant mayoral ambitions around carbon neutrality, but it was a wider plan. As examples, we worked with the Transport Authority about more sustainable transport options for our healthcare staff. About 1 in 5 staff work for the NHS in Greater Manchester, so it was a huge opportunity for influencing travel. We looked at how our fleet could be greener, how we could change our service delivery to reduce travel. We partnered with nature groups around the city region to bring in funding for green social prescribing projects. And we collaborated closely around the decarbonization of public estates in the city region to take advantage of common assessment methods and joint applications for funding and procurement. Greater Manchester was also required to develop a clean air plan for the region by the national government, and we worked closely with partners to ensure public health leadership and communications to elected officials, the public, and other stakeholders. And we also use this as an opportunity to engage and educate our own staff around air quality issues and the actions that they could take. And finally, we needed to ensure that our own operations and strategic plans were clearly aligned with environmental targets. And there's been great national unit in England doing work on this, which led to the release of a work plan committing for the NHS to become the first net zero health system in the world. And this was built on great analysis that showed that the NHS contributes about 5% of national carbon emissions, and a clear breakdown of what that was, which is helpful for planning. We know that the system also accounts for about 3.5% of all road travel, which is about 16 million kilometers a year. And that information helped leverage different work streams and provided templates for local baselining. And so knowing, for example, that 4% of those carbon emissions from the health system are from greenhouse gases from inhalers, that we obviously took this as a key opportunity. And in fact, through local analysis, we determined that the 5 million inhaler devices prescribed every year in the city region were equivalent to 519 flights, full flights across the United States. And action on this work to shift dry powder inhalers was not just an opportunity to reduce carbon emissions, but also had that population health focus in mind. We knew that we could try to ensure proper patient reviews and prescribing, referrals to community respiratory programs, advocacy on issues such as air quality, and engagement and education with our staff and stakeholders. There's no significant and challenging work underway around single-use plastic usage, and the pandemic obviously resulted in significant increase in PPE usage. This is an excerpt from a study that found that the carbon footprint of NHS PPE usage in the first 6 months of the pandemic was equivalent to 106,000 tons, which is about 245,000 barrels of oil. And more studies are emerging that, again, that population health lens, that humans are now eating, drinking, or inhaling tens of thousands of particles of microplastics every year. So more work is needed to understand the impact on human health. But there are positive opportunities. In this graph, you can see that through a modeling scenario showed that we could have reduced 75% of that carbon footprint and those single-use plastics through better recycling, reduced usage of gloves when not necessary, and other measures. And there are alternatives for other single-use plastics in healthcare being developed at a national level. So overall, I think there are some really exciting things happening in the UK. Since 2016, the UK Health Alliance on Climate Change has brought together colleges and associations, including public health, to advocate to decision makers and educate the public. About 1 in 10 people in Canada work in the health and social care field, and almost every Canadian would engage with the healthcare system at some point during the year. So we have an incredible opportunity to leverage that influence by educating our staff, educating and empowering our staff, and service issues on these issues and what they can do. And for us as the health system of Greater Manchester, it was all about embedding sustainable development in every aspect of our organization. We developed training placements with a focus on building the next generation of clinical leaders. We held carbon literacy sessions for commissioners, GPs, screening and immunization staff, and senior leadership, with the goal of creating environmental leaders across our different provider groups. And we made sure that every strategy included meaningful content on the climate and ecological crisis, and as well as what could be done about it. So there was that follow-up being done as well. In Canada, we take pride in our roots around health promotion and the determinants of health. So we must continue to build on the exciting work that's going on to embed our actions on the wider determinants of health through a planetary health lens. Thank you very much.
Thank you, Daryl. And I just want to remind folks that the Q&A is open. So as we work through the presentations, if you want to type in your questions under the Q&A tab at the bottom, you can also upvote the questions that are posed there. And our panelists will have a session at the end of their presentations where we will explore your questions. So thanks so much, Daryl, for giving us some insight into what's happening in the UK at a national level. Now we'll transition over to Dr. Thompson, who will speak to us about the work that he's led in his organization in the US. Over to you, Jeff.
Thanks, Kathy. Thank you very much for inviting me. I'll apologize in advance. I spent some time with my 2-year-old grandson recently, and we had a great time, but he donated some of his non-coronaviruses to me. So I'm a little garbly, but I'm very excited to be with the group. And Daryl, that was a terrific presentation, a great approach. My session here, as you heard in the introduction, will focus on what we did. So a little bit what we did, a little bit how we did it, and a lot of kind of the why connected with the how, the navigating this. Many of you are very excited about this work, and the question always comes up is, how do you move along your organization, how you move along your community organizations or a province or a territorial organization to move forward. And so that's what I'm going to talk about in the next 10 minutes or so. I have a few slides here that I have great hopes I'll be able to show you. And And there we go. So the first talks about our realization that we were a problem, and we framed all of our work around the fact that we're a healthcare organization taking care of people in our region, and we contributed to the problem. So I didn't go to the board and say, I'm really worried about, you know, the Arctic ice sheet or the permafrost or the polar bears. I went and said, our pollution is causing our patients and patients around the country to be sick. We talked about 465,000 pounds of particulate matter that made our patients sick in our region, and all these other noxious elements. Mercury, we have a lot of, we're on the Mississippi River and the flyway, and so mercury in the water, in the soil, for the children, for pregnant moms, for all those other animals and birds, was a big deal. So we framed it in that piece and said, we have to lower this down. And so in 2008, we set a goal to be powered 100% by renewables by 2014, and renewables that we owned, and that would lower this burden of disease production that we were a part of, that would save us money and would improve the local economy. So we tried to hit all those marks, and we promised our board that's what we would do. And part of the strategy you're going to see coming out here in the next few is that that was a strategy to broaden the tent, to get people that were passionate about the health effects of pollution and climate, to get the people that were mostly focused on local or the organizational finances. We tried to pull them all inside the tent. So to do this, it took a very broad program. So over those years, we started out with conservation, and I put a big circle there. I said some of the other things we did was very fancy. This was the one that really hit the marks the most. We lowered the cost of care. We invested a couple million US$ in the first 2 years and saved over $1 million every year thereafter. We got a 60% return on that investment. Well, there wasn't many other things you could do, healthcare or any place else, to get a 60% every year return on your investment. So we really focused on that and said, this is what we're going to do, and this is how we're going to do it. We're going to be disciplined. We're going to help the local economy. We're going to improve our pollution profile, and we're going to save money. And then we added in wind locations with a variety of partners. The first wind was with a big construction company. The next wind was with Organic Valley, a giant nationwide family of 1,400 farms that had its headquarters not far away. The landfill, we worked with the county. The biomass boiler, we worked with a regional manufacturer to build this very high-tech, almost pollution-free hardwood biomass boilers that could heat and power parts of our hospital, the power of that geothermal system that you see farther up. So we're powering our geothermal system with renewable energy. When we built a new hospital, we partnered with architects and builders from across the country to say, even in a northern climate, I know there's a small portion of Canada that might be considered a northern climate, but a northern climate, and they came out with original proposals of very high amounts, kind of the normal amount of energy used per square foot. We had them have that, and we hit those marks. So you look for partners in many different areas. The dairy biogas had a county, a federal, a state, and business partnerships to make dairy biogas viable. So the compilation was really quite effective at building partnerships, but continue to hit this mark. The mark was lower our pollution that was making people sick. So from 2008 to 2016, we pushed carbon dioxide, particulate matter, mercury, most of the major measurements. other greenhouse gases down over 90%. Wasn't easy. It didn't happen magically. It was a group of wonderful people, engineers and nurses and docs and community members and partners. So it's a broad coalition of people that said, we can do this and make this much, much more effective. We can hit the financial mark. So we took our investment in all that infrastructure you saw came out of our savings. In the US, many of the health systems have savings. And so we took our savings, instead of leaving in the stock market or cash or T-bills, as you see, we put it into this infrastructure. And during that time, we had a better return than our other pretty conservative investment that you can see there. So we did fine on that. Where did this come from? It came from our strategic plan. It came from the purpose of the organization. The purpose of the organization is to improve the health and well-being of patients in our communities. So we constantly referred back to that. It wasn't about climate change, although if they asked me, I would tell them clearly what climate change was going to do to our planet and our health and people, especially people with less means. But we embedded it into the organization, so it was a part of the fabric of the organization. Now, it wasn't easy. The board wasn't really excited about this. We had to start out with, we're hurting people. As I said, we are going to save money. We're going to improve the reach. These were the priorities of the board members. So we framed our argument to do that. When we went out into the community to get community partners, we did the same thing. People were passionate about different things. We tried to hit the major buckets that people were passionate about. You have to understand what's motivating people. Some people are very short-term oriented. We could hit short-term. Some people have a broader long-term vision. We did that. So when we started our program, we tried to measure both short and long-term pieces. And as I keep pointing out, we related it both to health and to the economic well-being. And in those days, it was pretty hard to climb that ladder. People weren't necessarily connecting with health. And now we, of course, have many more reports out about pollution and health. I mean, the Harvard report just came out saying 8 million deaths around the world caused by respiratory pollutions, many more from other causes. We built the stories and the data together. We wanted to have them together because, again, different people respond to different things. And we had to prove the progress. You have to really measure hard because there's lots of people that are still convinced it's either finances or their environment or jobs in the environment. So you have to prove it to them. You have to prove it over and over. And just because other people haven't done it doesn't mean you can't do it. That your community, your province, you can do this. It just takes a lot of courage to set the mark, a lot of discipline to follow through, and durability, as you're going to get beat up along the way, almost for sure. So you have to understand another important piece that we learned is you have to find out who makes the decisions, whether it's in your own organization or a community partner, and whom do they trust, and what are they afraid of? Some people are, Lynn Twist wrote a very interesting book, The Soul of Money, and it's really not about money. It's about how people think. So many people are stuck in a scarcity mindset. Oh, we got to hold on to it. And other people are much more of a sufficiency. We have all these assets. We have these brilliant people. We have nurses, doctors, respiratory therapists, administrators. We have these great people. Of course we can do this. So it's kind of, the mindset is really quite important. You have to measure what's really important. There's many reports coming out now how recycling is not going to save us. I mean, Cassandra Thiel from New York Longo, 1% of their carbon footprint could be managed by a very aggressive and successful recycling program. And we, of course, know most of them are not. There's a lot of things that could tip us off. So you take data and you start looking at the data. It's what's going to really help recycling or not. What are these major things that are going on that could really affect us? The big corporations, British Petroleum, changed their whole organization. The NHS, we already heard from Daryl's talk was great. Explaining how you can systematically go after this. And of course, the big tech companies are going after it as well. So you got to have your data available. You got to pay attention to what's changing and what's moving. Think of the other large social movements that are moving along. If you put all this together in an organization, here's what it looks like. It looks like a continuous built-in piece. When you look at the flywheel for Gundersen, it was our mission and values. We talked about that. An explicit culture. We're going to take care of the community as well as patients. You get people that believe in it. You measure that. You follow it. You make sure finances and facilities are tools and not the goals. And you just prove you can do it. And that ends up in progress that you can count on. So in summary, we have to be clear on why we're doing this, and we have to build a strong coalition of people on how we're going to get there, because the how is not the same in every place. What worked for us is not going to necessarily work for you, and it changes over time. New technologies will get it changed. But if you start with a strong set of values that you're serving the greater good, and then you move forward with a disciplined, thoughtful plan, you can make significant progress. I know that was very fast. I appreciate the time. If there are any of you that want to send me a note or ask about other questions when this is all done, I'll be happy to answer your questions. Kathy, back to you.
Thanks so much, Jeff. That was awesome and so important to connect the why to because we know we change from our hearts, not our heads all the time. So thanks so much for putting that in the context. So thanks. And our last speaker is Neil Ritchie, who is going to take, I think, what we've heard from Daryl in the UK and Jeff in the US from a health system perspective, and share with us how that's coming to life here in Canada through the Green Healthcare Coalition. So without further ado, over to Neil.
Well, thank you very much, Kathy. It's a real pleasure to share the webinar with Jeff and Daryl, because this is, of course, a global problem, and it's really terrific to learn about what's happening in other parts of the world. There's a lot we can certainly do to learn from others. Just going to share my screen for a sec here. Okay, yeah, so the Canadian Coalition for Green Healthcare is a national not-for-profit. We're all healthcare organizations and basically provide a resource network to build capacity for healthcare leaders and professionals. We have a vision that every healthcare organization supplier in Canada will be a champion for the environment. So we're a resource network for the circular economy, green procurement, energy and water conservation, safer chemicals, climate change, adaptation, resiliency, and waste management. Also green food and transportation. So first, it's important to recognize, as Daryl mentioned, that climate change is with us now, and we really need to adapt and build resilience to it. So it's actually a board responsibility, and I think there's been some legal rulings on this, to consider climate change as part of enterprise risk management programs for hospitals. So it's really important to talk about climate change resilience and adaptation today, as we talk about moving to net zero in the future. So globally, there has been a race to zero campaign that was developed by United Nations Climate Change Group, 471 cities, regions, universities, and businesses, and of course investors, as Jeff has mentioned, have signed on to this. But of course, hospitals yet have not really done this, and not only in Canada, but the rest of the world. Here in Canada, as you know, with Paris commitments, we have a fairly important commitment to lower our greenhouse gas emissions to 523 megatons. However, with current progress, we're not actually looking to make those targets, but I think we're going to see some new announcements on Thursday, on Earth Day, about that. But we certainly will see more government action. The government of Canada has started to do this by developing something called the Pan-Canadian Framework on Climate Change and Clean Growth. A Net Zero Accountability Act was just developed and implemented in late 2020. There's an overall greening government initiative, and that focuses on these 4 areas that you have on your screen. And there's also this year, Environment and Climate Change Canada has implemented a plastics initiative, and we're actually part of that. I'll tell you about that in a minute. So measuring carbon emissions is a real problem. It's a real challenge. There's recently been a WHO panel of experts convened to look at how we might be able to do this. The NHS, as Daryl has mentioned, is probably a leader. Healthcare Without Harm in the US has developed some methodologies. Also France, the Netherlands, I think, and United Arab Emirates have developed some methodologies. And here in Canada, the CHIO, the Children's Hospital of Eastern Ontario, has started to develop a carbon dashboard. But nationally, really the only thing we have to tell us what's happening in terms of environmental performance is something called the Green Hospital Scorecard, which we support. And as you can see, we have a number of different parameters that we measure. There's a benchmarking tool. About 100 hospitals a year report into this system, and you're able to benchmark your performance in accordance with your peer group, as well as to take a retrospective look at what's happening. So just a few observations from the scorecard that we have. You can see that while less than half of the respondents did assign somebody to be responsible for climate change, not a lot of respondents have really identified specific strategies around that, and there's not a lot of sort of regular discussion of that particular topic. We also, in the scorecard, ask respondents to tell us about whether leadership is actively engaged in greening of the hospital. And you can see from this graph about less than half of them have said that they were, but less than a quarter actually have active green teams that are working on this. As well, energy use intensity, which is sort of a relative measure of energy for all the hospitals. And here you can see we've broken it down by 4 peer group hospitals. Really hasn't made a huge reduction, which is what we'll need to see in future if we're moving forward. And then finally, looking at green hospital procurement, we have 40% of the respondents had a policy, but fewer of them have targets or action plans around implementing green procurement. So how do we move forward in this area as a nation? Well, Healthcare Without Harm, and I know Jeff is involved with this organization in the US, has actually recently developed a roadmap for healthcare decarbonization, which I think you'll find interesting. They identify 3 different pathways. And the first pathway is to decarbonize healthcare delivery and operations. And This is very much in line with what Daryl has said in his presentation. Basically, it's first of all reducing demand for services through prevention and health promotion and those sorts of better chronic disease management. Also, matching the supply of services to the demand, okay, through better primary care and appropriateness of care. And of course, virtual care, expanding those sorts of things and using technology to improve healthcare. And I think this is really what we've seen in the pandemic. There's been a rethinking of all of these sorts of things. And what it does certainly give us an opportunity to kind of maybe reset our healthcare delivery system in a new sort of way. But the second pathway is looking at decarbonizing healthcare supply chain. And I'm going to focus a little bit more on that and provide some specific recommendations on how we might do that. Ultimately, as Daryl mentioned, we do have a huge influence on the people who work within the health system as well as the people that we serve. And so we can certainly influence the decarbonization in wider society and the economy through our actions. But to focus in on decarbonizing the supply chain, this is some data from the NHS that shows us that while the carbon footprint of healthcare is not really as great as the footprint from medical supplies, equipment, and other items in the supply chain. So you can see that about 2/3 of the emissions overall for healthcare footprint comes from the supply chain rather than within the supply chain, or within the organization. So how do we decarbonize the supply chain? Well, basically, it's moving our whole economic thinking from a linear economy to a circular economy approach. And this is basically recognizing that the typical approach of reduce, reuse, recycling puts maybe too much emphasis on the consumer, and we need to talk about changing the entire system, so more responsibility is placed on the suppliers. So you basically design a waste, keep products in use, and regenerate the natural systems. In order to achieve this, leaders can do a number of different things. First of all, look at adopting value-based sustainable procurement methods. Considering product as a service, where you maybe don't own that MRI, you actually have it provided by the equipment supplier who charges a fee for access. Extending producer responsibility and take-back programs are other sorts of things that are becoming more and more popular. And of course, reducing single-use items, very important, and particularly as we see this huge increase in PPE supplies during the pandemic. And finally, looking at sharing platforms. The coalition has actually have a couple of projects relating to those last two items. We're actually just starting a project with a couple of other hospitals and it's funded by Environment and Climate Change Canada to look at how we can reduce the use of single-use items and also demonstrate collection and recycling of them to other sites. So UHN and Green Care BC, which is the Lower Mainland Facilities Group, and the University of Toronto are helping us in this regard. And there'll be other suppliers brought into the program later on. The other example is a sharing platform which we have developed and in partnership with a Dutch company, Flow2, And basically, it's a national online asset sharing platform for healthcare organizations, right, and their suppliers. And what we're focusing on initially are the PPE suppliers of hospitals. And of course, that can be expanded to other items. For now, it's free during the pandemic. And this is sort of like a Kijiji for healthcare organizations. So in summary, if we want to look at step back and say, you know, what are the kind of high impact actions that we can take to decarbonize healthcare? Again, Healthcare Without Harm has come up with these 7 high impact actions, and I'm just going to highlight them here. First of all, power healthcare with clean renewable energy, which is of course what Jeff's organization has done, and looking at infrastructure and buildings differently so that they're built to a net zero standard. Transportation and travel is extremely important, and we are seeing more and more incentives, for example, for zero emissions vehicles here in Canada. And we'll see that I think Europe has made a commitment to all electric vehicles by 2030. Looking at sustainable food and trying to look at how we're actually developing our agricultural practices. And then, of course, pharmaceuticals are a big part of the supply chain, and looking at ways to decarbonize those. As I mentioned, coming up with a more circular economy and managing waste better. And overall, ultimately moving towards a greater system effectiveness. Now, of course, there's challenges for us in moving forward as a nation. We have competing priorities, all of us. There's lack of committed resources. The governments are variously committed at different stages to this, but there's quite a bit of variation in what's happening across the country. And there's difficulty to get national consensus on how to measure and how to coordinate actions. But the college, I just wanted to remind you that the college is actually doing quite a bit and moving forward in this area. They formed a green team and committed to greening the college operations. And they've identified environmental sustainability as one of the sort of causes that they will be focusing on through their strategic plan. And we'll be looking to engage the chapters in further discussion and education on how we can move forward. So that's my presentation. Thanks very much for your attendance and your attention, and I'll turn it back to Kathy.
Thanks so much, Neil, and thanks to all 3 of our panelists for giving us some insights through different lenses. The seats that you sit in are different ones, and but each of you have had some common threads throughout, and leadership is definitely one of them. Contextualizing this challenge as a health challenge, I think resonates for all of us. And I think a focus and using some change management to as a kind of pulling our movement along in a way that we can, I think, focus our efforts to have the most impact. So we have some questions that our attendees have provided to us. But before we get to questions, I want to say, Amy, this is the poll time. I missed taking the poll at the beginning of our session together. So we would like each of you to participate in giving us some information back. And we have this question to pose. How far along the journey to net zero is your organization? So we have 72 of you participating today. And so just to try and get a sense of where you are on this continuum. Haven't thought much about it. Your organization's committed to learning more. Senior leadership has made a commitment to pursue net zero. Resources are in place, the people and budgets to get to net zero. You're already there, or you're unsure. If you want to take the next 30 seconds and answer this, and we'll have some sense, we'll play this back to you at the end, but this would be very helpful just to get a sense of where we are for the attendees across the country who are here on the call today. So as people are taking a minute to answer this poll, I'm going to ask our panelists the first question from the audience. Apart from new policies and resources directed at large facilities, hospitals, and other health institutions, what changes can be made by community-based practices in clinics, like community family practices that are privately run businesses, so that they don't have the resources of a health authority behind them? So that's a question. Maybe I'll direct this one to Jeff, where he's talked about the economic drivers, connecting that with the actual practice of healthcare. So Jeff, do you have any advice for people who are working in the community and in family practice type clinics who might not have the infrastructure or the policy framework to support them?
Oh, I think so. I think they can be very, very impactful in their communities. You don't need to put up a windmill to be an important player here. They are trusted, they are advisors, they are thoughtful, they speak to patients and families one-on-one, they speak to the community at the PTA meetings and in their faith community and all those places. There are many places where they can have an opportunity to help lead the citizenry broadly, speak to the government. There's so many things they can do. They can demonstrate and educate about how much more important it is to reduce what you use rather than the dream of recycling. Something I'm not against recycling. It's just that it's so less effective than reducing the energy use or the materials you buy or the circular economy approach that Neil was talking about. Every piece of their interaction with who they buy things from, their staff, their patients' families, their community, they can make an impact all the way along the way. And so I think they can have a significant impact in improving our climate footprint.
Thanks, Jeff. Daryl or Neil, would you like to add to that?
I was just going to say, we actually have something called Green Office Toolkit that we developed specifically for primary care. And I'll put a link to that in the chat. So, and it's on our website.
That's wonderful. Thanks, Neil. Daryl?
Just echo a lot of Jeff's comments on the influence that they can have, the interactions with patients. So we in Greater Manchester, we actually had quite a few GPs who were real champions for this and helped us to develop training programs for GPs in training. So we're excited about that. We're building that next generation, and they have the ideas that would come out of things around things that don't cost money. They're just about how you approach, prescribing and prevention. So there's lots of things that can be done that just through collaboration, not actually sort of investment in, financially of things that can be done. Of course, the current circumstances, it is challenging to implement some of these things, but I just think there are real opportunities there as well.
Thanks, Daryl. And certainly the last point Neil made in terms of the change agenda that we've seen through the pandemic and the adoption of virtual care. I know here in British Columbia, that's been a huge movement to move primary care to virtual where possible, and trying to get that balance right. So I think that's another concrete example of what's happening in our communities. Thanks so much for those resources. This one I might direct to Neil, which is, as many our attendees know, and I'm sure our panelists are aware, we have across the country, the federal commitment to a carbon tax, as well as provincially, many of our provinces, British Columbia again being one, have adopted a carbon tax framework to change our behavior. And so this question is, please advise on the potential impact of the carbon tax for healthcare facilities. Neil, do you have any insights on that?
Well, I think it won't affect hospitals differently than other organizations, other than the fact that they're high energy users. And of course, the carbon tax will be increasing the price of energy. And so it does create more of an incentive to move to renewables, of course. But it will impact the cost of supplies and other items, particularly ones that are transported from other areas. So I think the idea is to put a price on pollution, and hospitals, as Jeff mentioned, we're polluters ourselves, right? And so we have to, the tax will certainly affect us in that sort of way as well.
Thanks, Jeff. Or Daryl, would you like to comment on the impact of a carbon tax?
I think around the Europe is using it, the US is debating it. I think the key is virtually every economist around the world that's really studied this has said, we're making good progress. There is, where's the auto industry going? Where's that? But almost all of them agree, if we're going to hit our marks to really mitigate the most severe parts of climate change, it's going to take a large monetary structural system, and they see some type of carbon tax and carbon fee a part of that. So I think this is where things are going to go. I think it is likely to move things along. I think hospitals, for their financial resiliency, need to be pay attention to this and say how, whether it's the supply chain that was talked about at some length, or their energy, or their transport, how are we going to mitigate this almost for sure potential upcharge? How do we decrease that effect on our organization? So I think now's the time to be planning.
Thanks, Jeff.
And
Daryl?
just not specifically on the carbon tax, but I mentioned in my presentation that Greater Manchester has required to develop a clean air plan. When part of that includes a clean air zone, which is charging high polluting vehicles, and that impacts on our fleet. And so we've used that as leverage about fleet transformation, and there'll be other city regions across the UK who will be in a similar position. So it's a nice sort of leverage again to move along that transportation, as well as getting those public health gains from it.
Great, thanks. So I think that, again, on when we're creating a movement for change, there's the carrot and the stick, and so that we need to draw people in to the change with the case that all of you have made, and as well as the tax framework or the economic framework can be part of the forcing function. Next question is, on average, how committed do you believe are Canadian healthcare organizations to a climate commitment? And Neil, I'm wondering if you might have some insights based on the work you've done around the scorecard.
Yeah, I think it is a concern when you look at about the 100 hospitals that are submitting data. These are the ones that probably have the greatest interest in environmental performance. And as you can see from some of the data that I showed that we're not making the kind of transformational changes that are really needed. And I think what I see is that, senior leaders have so many other things on their mind. And this is sort of like seen as sort of one extra kind of thing, but really it's as professionals, it's part of our moral and ethical responsibility. If you look at the code of ethics of the college, it's really embedded in there. And as Jeff pointed out, this is really as much a health issue as it is an environment issue. So I think we need to look for ways to kind of take it up a notch, really.
And just in the interest of time, I'm going to move us along, but just to connect the dots, I think that what I've heard today as a leader, as a senior leader of a healthcare organization, I'm going to take away from this is that case for change as it relates to health. So we have an obligation to, in our organization, excellent health and care for everyone, everywhere, every time. How can we do that and pollute at the same time? So if we're creating a harm in our communities, we're not fulfilling our mission and vision. And so I think that's that ability to connect this work to our vision and mission as healthcare organizations actually is quite compelling. So for me, that's actually lit more of a fire. If I'm allowed to light a fire, it's shone a light. I don't know what the metaphor is that's climate appropriate, but it's done that for me. The last question, and I know we're down to 2 minutes, is coming from the Champlain e-referral team, is as a part of the Ontario e-services program, what would you suggest that we consider to help greening the Ontario healthcare system in our work? Jeff, do you want to, I know you have to depart here shortly. So this is a team that's been set up to move electronically and get rid of paper, it sounds like. So what advice do you have for them?
Well, I think they have an important role. This has a great opportunity to do a number of things. Of course, electronics during COVID, telehealth had a big explosion, and now we can settle out and see where that is. As you mentioned, Kathy, what is the most appropriate balance there? I know a number of the major electronic health vendors have environmental pieces built into their electronic records, so they should look to see whoever they work with, how is that going to help support them going forward in this mission. So I think there are many things that they can do. My suggestion to them is be thoughtful about measuring what you accomplish, because it's important. People get used to a new normal, and it's important to measure where you're at now. So when you make progress, you can show people and say, I know it was hard work, it was culture change, but here's the difference now. Here's the benefits we get every single day. Here's the pollution we're not causing. Here's the money we're saving. So I would suggest that for them. I just want to say thank you very much to the group for allowing me to be here. I have another a big speaking thing that I starts in 1 minute. So I need to leave, but I appreciate the opportunity, and I can't wait to when Canada will once again let me come visit.
So thank you to Jeff. Thank you, Daryl. Thank you, Neil. On that note, I think it's a lovely way to wrap up the importance of measurement. Thank you all for attending today. It's been a pleasure to be with you, and I know I've taken some takeaways. I hope each person has, to be able to bring back to where we end up doing our work every day, to take care of ourselves, take care of the people we serve, and take care of the planet that we have the responsibility to care for. So thanks everyone, and have a great day.
Thank you.
Bye.
Thanks, Kathy. Bye now.